Hello everyone, it's Elise as Another Truth on YouTube. I hope you're all doing well and you're taking exceptional care of yourselves. I hope your upcoming weekend will be restful and recuperative. Now, I wanted to take a moment to share some insights on a recent X post posted by Balls involving Katie Joy, who is also known as Without a Crystal Ball. Now, it looked like it was a commentary from a professional to talk about cluster B personality disorders and how someone might have other things going on. And Balls, in the video, it inserted, I don't know who it was, if it was Balls or someone else inserted Katie Joy in emphasizing each point that this professional or this commentator was making. It was really interesting, to say the least. And it does bring about discussion on people who deal with more than one type of cluster B personality disorder. Now, it's important to clarify that everything I'm about to discuss is based solely on my personal opinions and perspectives. I encourage everyone to conduct their own research, form their own conclusions, and use that information they discover responsibly. Now, again, I want to circle back to that particular post. So there was this intriguing discussion about the possibility of someone with a cluster B personality disorder also having another cluster B personality disorder. Now, as a non-professional, I'm not in the position to diagnose anyone, including Katie Joy, but I'd like to share some thoughts based on my own experiences and observations. The personal experience in cluster B personality disorder. I live with borderline personality disorders, and I've faced various mental health challenges throughout my life. My experiences have significantly shaped my understanding of mental health issues, but it's important to remember that mental health struggles exist on a broad spectrum. That includes personality disorders. Not everyone with a cluster B personality disorder will exhibit the same symptoms or behaviors, sometimes not all at the same time. They may only experience two changes within one cluster B. Now, under borderline personality disorder, they say there are 4 or 5 different types. I don't think there's a type. I think I've experienced certain things within that at different points in my life, given my life experience. Now, currently, I'm also being evaluated for Autism Spectrum Disorder, which my son was diagnosed with later in his life, and quite recently. While I don't view autism as inherently problematic, it presents its own set of challenges, especially in a world that may not always be accommodating. Now, my observations on Katie Joy. Regarding Katie Joy, I've noticed certain behaviors in her content and interactions that resonate with my own experiences of BPD. Now, remind you, I'm just a lay person, someone who's experiencing BPD from a different point of view, from a different life. Okay, I'm not a professional in this. Now, for instance, her conduct in live chats and videos suggest patterns that might be familiar to someone like me with cluster B personality disorder. However, it's crucial to emphasize that these observations are not a formal diagnosis, but rather personal reflections based on what I've observed and seen. Now, in my own journey with borderline, I've struggled with self-sabotaging behavior and ongoing difficulty in relationships. Over time, and lots of therapy and lots of engagement in my own therapy, I've worked to balance my hyperempathy, a trait often associated with BPD, with a more calculated approach to interactions. Now, that's not to say that it's not bad, because hyperempathy, for me, it's been a roadblock in not seeing people for who they are, not respecting someone's whole person. And it's not To say I don't care about that person is that I don't see it from their perspective. It's not that cognitive empathy. That's what I'm referring to here, where it allows me to see a person as much as I can see a person and understand that they are a human being. Hyperempathy can be both a strength and a burden, leading to intense emotional responses and heightened sensitivity to others. Now, this is where the role of soft skills come in. Now, I'm referring to this in employment and personal growth, probably more on the personal growth side of this. Soft skills are critical both in personal development and professional settings. Like these skills, which include communication, empathy, problem solving, and adaptability, play a vital role in how we interact with others and navigate various life situations. For individuals with mental health challenges, developing and refining soft skills can be particularly beneficial. In my own experience, balancing self-care with serving others has been an essential lesson. Engaging in volunteer work and pursuing personal development have provided me with a sense of purpose and have allowed me to contribute to society positively. It's increased my engagement. It's increased my interest in others. I've sought professional coaching to better manage my mental health and enhance my soft skills, which has been instrumental in growth in both those areas. Now, soft skills are not really formal qualifications or certifications like you would get in a job training program, in a certified course or a college education. They are often developed through personal experiences and learning. They enable individuals to navigate social interactions, true, handle conflicts, true, and adapt to various situations effectively. Now, for someone like me with a cluster B personality disorder, honing these skills have led to more constructive interactions and better all functioning. This is the key that's missing out of this kind of treatment. Now, it's hard because we live in kind of a world where there's a specialist for everything. And it's important people do have specialized skills to offer. But I do think that understanding your soft skills as a person can boost that confidence to make you feel good about yourself, to make you feel like, oh yeah, I can do this. I didn't realize I had this talent. Oh yeah. And working with someone who helps you jog those things through, who helps you bring that out, it's such a gift. I want everybody to have that if they want it, because it helped me go from 3 months ago thinking I had nothing to offer anybody to say, yeah, this is what I have to offer. This is what I have to offer to myself. And this is what I have to offer to someone else. It's an amazing, amazing experience to have. Now, I'm going to go back to my reflections on Katie Joy's behavior. I'm not trying to do a comparison. I'm just giving some experiences and my interpretations. Now, from my observations, Katie Joy's interactions and the way she presents her content suggests a degree of calculation rather than emotional drive. Now, that's not necessarily a bad thing, okay? Now, this greatly contrasts with my own experiences where my emotions often drive my actions, albeit with immense difficulty in managing them. It's a delicate balance to maintain, particularly when BPD. Now, with Katie Joy, and this is just my personal observation, that she is calculated in a way where it's completely self-serving. So my observation, there's no balance between self-care and care of others. I do not consider her self-sabotaging behavior, her self-centeredness, her insatiable need to get attention as a positive, calculated move. There's no balance, and there's no emotion whatsoever other than that anger and vindictiveness that comes through. Okay, now there could be other things going on with her. I don't know, but that's my observation. And nothing made that more evident or more open as it did in that Hello Starlight live. Now, people watch her lives all the time. Now, I don't go from live to watch her. Okay, I don't. But in that one live, it really... Now, I see how she handles stress. She doesn't handle it well. She doesn't handle any criticisms, even if it's coming out of left field. Okay, she didn't read the room. She didn't understand that her controversy follows her and that she has not held herself to account for the things that she needs to. She goes into these things expecting to be an expert, expecting to be unchallenged. In life, people are going to throw your past in your face. That's the way it is. Okay? And how you have worked through those weaknesses, how you've worked through that. Some things, they're just some things you can't do because of some things in the past. That's how our society works sometimes. But there are other things where you can say, yeah, I've worked on this. This is my behavior. This is where I'm going. Like, there are certain professions I could never do because I do not have the emotional wherewithal to do it. And I don't have the life experience of being able to manage my emotions well enough to handle certain positions. But those emotions are better set somewhere else in a different type of setting. It's not like the end of the world. Katie Joy's never made that kind of assessment for herself. She never worked with anybody. I can tell that it she operates solely on her own thinking. And there's not anything wrong with being independent, but there's no, even being mature and independent, there has to be room for criticism. There has to be room for accountability, because then you just don't grow, right? That's how I see it. Now, going back to BPD, there's a tendency among some with cluster B disorders to exaggerate their qualifications or importance. There are some of us who undermine that, and sometimes that can be used in avoidance behavior to get out of doing things. Sometimes some of us feel like we have nothing to offer, which isn't the truth. While everyone has potential and value, my own patience with Katie Joy has diminished due to her behavior, which I find troubling. This judgment is based on her actions rather than a professional assessment. I mean, this is something that she would have to evaluate on her own. Now, moving forward, I believe that individuals with mental health challenges, including those with cluster B personality disorders, can benefit from focusing on personal growth and self-improvement. Engaging in self-reflection, seeking professional help, and developing soft skills can significantly impact one's quality of life and interactions. Katie Joy, like anyone else, has the potential to make positive changes if she chooses to. Her actions and disregard for others' rights may eventually lead to legal consequences, but only time will tell, and those natural consequences might be needed in order for her to change. It's important to recognize that each person with a cluster B may exhibit different behaviors, and not everyone will fit into the same mold. I have worked to address my own issues and continue to strive for self-improvement. Constructive criticism and self-awareness are crucial for growth, and I encourage others to pursue these avenues as well. Balancing self-care with serving others is essential, and I've learned that taking care of oneself is just as important as contributing to the well-being of others. So as much as I want to be that advocate and that person who does that, and I do a level of that. Sorry, my cat is scratching. I do that. But ignoring what I need to do to take care of myself, that's not good. I want to live by the example. I want to be the example. Okay, I don't want to just be like a two-dimensional mouthpiece. I want to be the example. I just was not able to make those connections with my life experiences, what I have to contribute, and knowing my strengths, knowing my weaknesses, learning through that, okay, guarantees that I'm going to have some level of personal success, you know? Well, thank you for taking time to read my reflection, not read, but hear my reflections. Now, if you have any questions or need clarifications on anything, feel free to ask. And I emphasize clarification because sometimes it's hard for me to understand things sometimes at first. And I ask people, wait a minute, back up. Can you clarify what this means? Because I want to be absolutely certain that I'm not making a mistake in what I'm hearing. Sometimes what I want to hear precedes with what is being said. So taking time to ask for clarification will help you as much as it will help me. All right. It's always a pleasure to engage in meaningful discussions with you and speaking with you. And always thank you for your time and sharing your experiences and engaging with my material and listening to me. Take care. Have a great day. Bye.